Hello and welcome to the MediByte channel. We're jumping right into today's explainer because we're tackling a complex and honestly sometimes overwhelming topic, infertility problems with eggs. As a healthcare professional, I know how tough navigating fertility can be. So we're bringing the clinic directly to you. We're going to break down exactly what happens inside the body, how we evaluate your ovarian reserve, and look at the actionable treatment steps you actually have right now. So let's just dive right in. To really get a grasp on egg-related infertility, we kind of need to start with the sheer scale of female biology. It's actually mind-blowing. By the 5th month of gestation, before you're even born, a female fetus develops around 7 million eggs. 7 million! But here is the crucial takeaway. Out of those millions, only about 400 are actually released during a woman's entire reproductive life. That's basically just one egg for every single menstrual cycle. The rest, they just naturally degenerate over time. And this timeline perfectly illustrates that steep natural drop in your ovarian reserve. You start with those 7 million oocytes, which is just the medical term for egg cells, in the womb, and that drops to maybe 1 to 2 million by the time you're born. Then by puberty, you're looking at about 300,000 remaining. Now, that is absolutely still enough for a lifetime of fertility, but this drop actually speeds up in the 10 to 15 years right before menopause, hitting zero at around age 51. Seeing it laid out like this really drives home just how precious those remaining eggs are.
Now you might be wondering, does age only affect the number of eggs? Well, no, it's heavily about quality too. See, until an egg is finally released, it sits completely dormant. It's literally suspended right in the middle of cell division. And because these dormant eggs are just sitting there in this suspended state, they actually can't repair themselves the way other normal cells in your body do. So the window for damage simply increases as you age. Generally, we see the quality and quantity of your ovarian reserve start to dip at age 30, and then it rapidly drops off after 40.
While aging is the standard factor we look at, sometimes things happen earlier. Let's talk about primary ovarian insufficiency. This is a specific condition where that rapid drop in egg numbers happens way younger than average. You'll sometimes hear it called premature menopause, and for some women, this totally unexpected decrease is the exact reason their periods suddenly get irregular or just stop altogether.
Okay, before we walk through the diagnostic side of things, we need to talk anatomy for just a second. Specifically, the follicle. Your eggs don't just float freely in there, they actually live inside these tiny, fluid-filled pockets inside the ovaries called follicles. Every single follicle holds one dormant egg. Knowing this is absolutely vital because when we're testing your fertility, we're almost always looking directly at or measuring the hormones made by these exact little pockets.
So how do we actually evaluate your eggs? If you're over 35, or maybe you've had previous ovarian surgery, or you struggled with fertility meds in the past, how do we as healthcare professionals here at MediByte and beyond figure out exactly what's going on inside your ovaries? Well, we use a highly structured approach. It's essentially a combination of specific blood tests to check your hormone levels, paired with specialized imaging. The big ones we look at are the follicle-stimulating hormone, or FSH, your estrogen levels, and the anti-Müllerian hormone, which we call AMH. Combine those with a transvaginal ultrasound, and we get an incredibly clear, complete picture of your fertility baseline.
What's fascinating here is how we decode this blood work like a puzzle to find the root of the issue. For example, if we test early in your cycle and your FSH, the hormone trying to stimulate egg release, is super high, but your estrogen is low, that's a huge red flag pointing to an egg problem. On the flip side, AMH is one of our absolute best markers. Why? Because AMH is produced directly by the follicles themselves. So a low AMH level literally tells us straight up that your remaining number of follicles is small.
But we don't just rely on blood work. To confirm what those tests are hinting at, we use imaging. Transvaginal ultrasonography is a super safe, reliable tool that lets us look right at your ovaries. We can visually identify and literally count the physical follicles present. It completely takes the guesswork out of the equation, giving everyone a concrete, real-world starting line to work from.
Now I know, hearing that you have a decreased ovarian reserve or an egg quality issue can feel, well, incredibly overwhelming. But the entire goal of this explainer is to empower you. So let's shift gears and focus on the actionable treatment options you have right now. Science has advanced leaps and bounds here, and you absolutely have choices.
Treatment is never a one-size-fits-all kind of deal. It is highly personalized to you, your age, your labs, your unique situation. But generally, we follow a pretty structured ladder. We usually start with oral fertility medications,
If those aren't doing the trick, we step up to injectable hormones called human gonadotropins. From there, the next major step is in vitro fertilization, or IVF. And finally, if needed, we can look into the incredibly successful pathway of using donor eggs.
Let's look closer at those pharmaceutical options. Letrozole and clomiphene are your oral meds. Letrozole, which is actually an aromatase inhibitor, is very often our first go-to because it tends to have fewer side effects than clomiphene. But if those don't trigger ovulation, we bring in the human gonadotropins. These are hormones injected directly into a muscle or under the skin. They are exactly what your body needs to coax those ovaries into maturing the follicles and actually making ovulation happen. And of course, we monitor you super closely with ultrasounds the whole time to make sure it's safe and working.
So, what if medications just aren't enough? Or maybe time is really of the essence? That's where IVF comes in. It's a real game changer because we bypass a lot of the body's natural hurdles. First, we stimulate the ovaries to produce multiple mature eggs. Then, about 34 hours later, a doctor uses ultrasound guidance and a fine needle to retrieve those eggs straight from the ovaries. Next, we fertilize them with active sperm in a lab, let those little embryos grow for 2 to 5 days, and finally, carefully implant one or more right back into the uterus.
Now, for women over 42 or anyone dealing with severe primary ovarian insufficiency, where the number or quality of their own eggs is drastically impacted, egg donation is a brilliant alternative. Here's how it works. A healthy donor goes through the initial stimulation and egg retrieval parts of the IVF process. Then those donated eggs are fertilized with the prospective father's sperm, and that embryo is transferred to the prospective mother's uterus. It is a highly successful, completely realistic pathway to building your family.
As we wrap up the clinical side of things today, I really want to leave you with this deeply reassuring fact straight out of the medical literature. It explicitly says, a small number of follicles means that pregnancy after in vitro fertilization is less likely but still possible. Pregnancy may be possible even if test results are abnormal. The big takeaway here? An abnormal test is just data. It tells us how to navigate the map. It absolutely does not mean your journey is over. So what's your next step going to be?
Thank you so much for joining me for this explainer. I really hope diving into the science and the real-world solutions around egg infertility has brought you some clarity and maybe a bit of comfort, because navigating your healthcare always starts with understanding it. Please remember to hit that like button, share this with anyone who might need it, and subscribe to the MediByte channel. We are going to keep empowering you with clear, trusted healthcare knowledge. We are here for you every step of the way. See you in the next explainer.